Good morning, everyone. I'm Lance Rensalo Sara from BSN3. For today, I will demo the nasogastric tube feeding. For the assessment, check for the doctor's order. Next is the client's consciousness or level of knowledge and understanding about this procedure. Availability and functionality of needed materials. And check for the any clinical signs of malnutrition and dehydration. For allergies to any food in the feeding, if the client lactose intolerant, check for the tube feeding formula, notify the primary care provider if any incapabilities is existed. And we are going to move into the planning. Next is, before commencing the tube feeding, determine the type, amount, and frequency of the feedings and tolerance of previous feedings. For this procedure, we need to prepare correct type and amount of feeding solution. 60 ml of catheter tip syringe, embassis basin, clean gloves, pH test strip, large syringe or calibrated plastic feeding bag with label and tubing that can be attached to the feeding tube, or pre-filled bottle with a deep chamber tubing and a regular flow regulator clamp. And measuring the container from which to pour the feeding if using open system. Water of 60 ml unless otherwise specified at the room temperature. Feeding pump as required. And moving for the implementation of this procedure. Prior for performing the feeding, introduce yourself. Verify the client's identity using agency protocol, explain what you're going to do and why it's necessary and how can she participate, and inform the client that the feeding should not cause any discomfort but cause feeling of fullness. Next is perform hand hygiene, observe for appropriate infection control procedures. Example of this is putting clean gloves, sanitizing your hands. Next is provide client's privacy for this procedure if the clients desire it, if the tube feedings are embarrassing to some people. Next is assess the placement. Apply the clean gloves. Attach the syringe to the open tube and aspirate it. Check for the pH. Allow 1 hour elapsed before testing the pH. If the client has received a medication, use a pH meter rather than a pH paper. If the client is receiving a continuous feeding, follow agency protocol if the pH is equal to greater than 6. Next is assess the residual feeding contents. If the tube is placed with the stomach, aspirate all the contents and measure all the amount before administering the feeding. Next is administer the feeding, and before the administering feeding, check for the expiration date of the feeding. Warm the feeding to the room temperature. Rationale of this is an excessive cold feeding may cause abdominal cramps. Next is clamp the feeding tube. Clamp the feeding tube before all the water is installed. Rationale, clamping of this is prevent air from entering the tube. Next is ensure the client's comfort and safety. Secure the tubing of the client's gown. Rationale, this minimizes the pulling of the tube, thus preventing the discomfort and dislodgement. As the client to remain still, sitting upright from the Paulus position in slightly elevated right lateral position for that at least 30 minutes. Rationale, this position facilitates digestion and movement of the feeding from stomach along the alimentary tract and prevent potential aspiration of the feeding into the lungs. And evaluation. Evaluate the patient response to this procedure. Document all the procedure and the other important data in the client's charts. So, goodbye and have a nice day.